Hi,
Hey,
Dr. A.
how's it going?
It's going great. How are you?
Good. I'm doing good, doing good. How's your day?
Pretty good.
Good.
I on my third cup of coffee, which is probably not advisable from a cardiologist, but I
We'll
had
talk
a,
after on
we'll
that.
talk, yes, I had an early morning. Thank you so much for joining us today. Did I get your name right? It's Dr. George Adesina.
That was perfect. No one
Ah,
gets it right on the first try. That was perfect.
I love it. But you go by Dr. A.
Yes, ma'am.
Oh, that's awesome. And where's your practice located?
So I'm actually in Houston, and I'm doing a lot of remote stuff. So it's really opened up like access and being able to see people all over the country. So it's been great.
I love that. Everyone
Yeah.
should be following a cardiologist, by the way. And his handle is paging Dr. A. You can find it up here on my page. But I'm learning so much from following you. A couple of your
Oh, I
things went
appreciate that.
viral, and you give so much practical advice, which is one of the things we're going to be talking about today. I first just wanted to ask you what made you want to be a cardiologist, and what has sustained your passion all these years?
So I actually had palpitations growing up from a young child, and they kind of progressed and got worse as I started doing sports. And so it became a real concern for my parents and my coaches. And I actually had to go see a cardiologist myself in middle school. And it was like this aha life defining moment. Like from the very exact moment they started doing like an EKG on me and doing an ultrasound of my heart, and I was really lucky to have a heart doctor who he could see the interest there. He sat down with me, gave me a mini anatomy lesson, really made sure I understood everything. And I started to really figure like, this is something that I could do. And I think the biggest thing that stuck out for me was I remember being in the waiting room with my parents and feeling so scared or nervous to then being in the room with him and just feeling like everything was going to be okay. And that kind of like magical power of like helping people and making sure they were going to live longer and feel better. That's just something I knew I had to be a part of, and I've been hooked ever since.
Wow, that explains a lot about your social media and why you have an amazing bedside manner. Even it comes through, our phones, and it explains why you love to teach as well and educate.
Oh yeah, especially education. There's such a gap between I think the medical community and like the general public, and I try to use social media to bridge that way. So I'll try to entertain you a little bit, but definitely give you education. But then also I want you to see that I'm just a regular guy.
Yeah,
I just
like you
went to
put
school
stuff
for all
about
that.
you have your adorable family on as well. I've been enjoying like following your page.
Oh,
Um,
thank you so much.
I want to ask you about, I know that you're very passionate about serving your community. I'm also from Houston, by the way. I went to
Oh, I
Houston.
did not know that.
Yeah, my parents are there. I go home all the time. And
Oh, that's awesome.
I have a huge amount of family spread over South Texas. So next time I'll have to come say hi.
Oh,
Um,
for sure.
I love that. We can do a live, actually, like a real,
Live, live.
like the old fashioned live. But I know you're very passionate about serving the community. What are some of the biggest challenges that you've seen when you're, in underdeserved communities, especially involving heart health?
I think the biggest thing is access.
Yeah.
And it's funny because there's been an initiative to get quality patient care to so many people. But for a lot of underserved communities, they're just fighting for access. So not even the quality, they just want to be able to see somebody because the providers aren't there. In instances where the access is there, then you run into issues like transportation or insurance or sometimes just a language barrier, and all of that can create real obstacles. And
Yeah.
then on top of that as well, like I said, there's a little bit of a gap between the general public and the medical community. There's sometimes a distrust even, particularly with patients of color. And so all of that can affect the quality care that they get. And that's something that we're still kind of, fighting against and something I'm really passionate about fighting for.
I love hearing that. I hope that people find your page and get, really pay attention to what you're saying and fight for access and fight to find the right people that can help them. Uh,
Definitely.
we had some questions that came in when
Mhm.
I posted online yesterday.
Mhm.
One of the questions I actually have as well, I have a couple for you, but uh,
Certainly.
as far as being a woman, I know that sometimes we go into the doctor and we have a lot of questions, and I feel like I'm not really being heard. There's a
Mhm.
big movement for educating about perimenopause and menopause, and one of the main symptoms are heart palpitations.
Mhm.
But a lot of doctors, I feel like, either dismiss us. What would be your advice to someone like me or anyone else out there, whether it's in perimenopause or any other state of um, of their life where they're feeling like a doctor isn't listening.
Yeah. Unfortunately, even with me being a physician, I've had that happen to me on so many occasions. And it's funny because I always lead with, I'm a regular guy. I'm going to someone who's outside of my specialty. So I don't usually lead with, I'm a physician. But oftentimes I've had episodes where like they're just completely ignoring, or they're telling me that what I'm saying is made up in my head. And it's not until I have to kind of pull the doctor card that the conversation then
Change.
switches directions. Exactly. And so that always stays in the back of my mind. It's like, what about the millions of people who don't have this doctor card to play? And so, one thing that I try to teach my family members and my patients is that when you're in that exam room, your voice matters. When it comes to your healthcare, you should be an active participant, not just a mere bystander. So, decisions that need to be made need to be made with you in mind and with you in the conversation. If someone is making you feel like you having clarity or you understanding what's going on is not paramount, then you are not in the right place. And I always tell people, do not feel bad for seeking a second opinion. You need to be with someone that you can be able to have an open and honest conversation with. And it's not just like a style thing or a difference of opinion. Studies have shown if you have a good rapport with your physician, you are more likely to tell them things that you probably wouldn't tell someone else that you're not comfortable with, which can sometimes give us the details that we need to clinch a diagnosis. Oftentimes, if you have a good relationship, you're more compliant with the treatment plan because you have been made a part of that. And overall, patients do better. So you like your physician, you're actually doing better clinically. So there is research that supports this. And so I tell people all the time, your voice matters. Anyone who makes you feel otherwise is incorrect, and that's not the place for you at all.
I feel like I have to remember to actually write down my questions because I get confused, not confused, but it's a little overwhelming sometimes when you're getting a lot of information from the doctor to remember all of
Mhm.
your questions. And yeah, I love that. Just your voice is paramount. And if you don't feel heard, you don't need to go back, find another doctor if you
That's
can.
it's almost like a relationship. That's a red flag in a relationship. If your voice is not being heard, whether that's romantic, professional, if your
Yeah.
voice is not being heard, that's never a good sign, right? And I
Yeah.
think the essence of a patient and physician relationship is it should be a partnership. You're the expert at your body. You know it when something's wrong. I might be the expert at cardiology, but you're the expert at your body. Us coming together, that's how we make solutions. That's how we make change.
I love that. It's actually very empowering. What do you think are this was one of my questions too. What do you think are one of the main misconceptions about heart health?
I think you hit the nail on the head earlier when you were talking about this wave that we're now kind of recognizing the effects of menopause with heart disease. I think the misconception of heart disease being just like a man's disease, of an elderly man, that's the condition that they get. And for a long time, women were just not a part of that conversation. And we are just now catching up with that conversation. In the future, women have to be a part of this discussion, knowing what it looks like in women. How is it different? How does it feel different with women compared to men? How can they be better advocates for themselves? Specifically for menopause, I think also looking at how your risk factors and your risk for heart disease change in your lifespan. So when you're in childbearing years versus after menopause, those are clear changes that no one's talking about.
I
And
know.
yeah, it's and that's why I really like that like celebrities like Oprah and Halle Berry, they're raising the conversation for this. So now we kind of have no choice. Pop culture is actually driving this. So hopefully we wake up. But I also want to say I think it's really paramount for women to try to enroll in clinical trials because
Oh,
oh yeah, a lot if you look at a lot of the information that we're going off of, most of the participants are men. And so we need clinical trials that are specifically looking at the treatment protocols that will make sure that women are feeling good and living longer. So that's a really big caveat that I wanted to make sure we talk about as well.
I'm really glad you said that. And if you, for our viewers, and if you're viewing live or later, you can go to Patients Like Me and sign up
Mhm.
for clinical trials. They have a whole section, not just for heart health, but for a myriad of different, things that could be going on with your health. So please, please, please check that out. I'm so glad you said that. I wouldn't have thought that that would be a wise thing. It just didn't occur to me. So that's what these things are really all about.
Exactly. We're making change.
So heart palpitations are. I saw a menopause special that Oprah did, and she said that
Mhm.
she had heart palpitations, and she thought she was something was really, really going on with her. I don't remember if she
Mhm.
said she thought she was dying, but for a couple of years, she went to many, many specialists. So this is something that if we start feeling that in perimenopause, should we get a cardiologist?
So we always say medicine is almost like a relay race, right? And for me being a specialist, the first stop should always be your primary care provider first. Because there's certain workups that they might think of that we may not, and then they'll pass the baton to us like, "Hey, I've done all the regular stuff. There's nothing coming up on here. Can you please take the next leg of the race?" And so
And
that's usually what we do.
and that's something that we can actually advocate for ourselves. If we feel strong,
100%.
primary care physician is not um, taking it further, we can say, can you recommend or refer us to a cardiologist?
100%. And it's particularly with menopause. I mean, we're seeing the effects of estrogen. When that natural estrogen in the body drops, there are real consequences to it from the body. And one of them is your resting heart rate drops up. And so, with that increase of your resting heart rate, you are now more susceptible to certain arrhythmias or palpitations that you may have not felt in
Oh,
your
yeah.
earlier years. And so, it's hard because not a lot of people are connecting the dots. And for us as physicians, it's really important that we take that step back and take a bird's eye view to make sure we're connecting the dots and we're looking at everything as a whole.
Thank you. I'm sitting here thinking of all the conversations I've had with on Women Like Me and then with friends that this is a really big it's a big issue, and it's definitely you're going about your life and you don't realize that a lot of times I'm doing much better right now, but I would wake up in the middle of the night with my heart racing, and it didn't occur to me that it could be associated with perimenopause. So
For sure.
I'm learning so much. I'm really grateful that this conversation is really coming to the forefront. Like you said, celebrities and pop culture are just forcing
Mhm.
us to really look at this. I have some other questions too, but
Definitely.
my next one is looking from uh, the audience. If we could make one change today that would definitely help the future of our heart health, what would that be?
Ooh, just one is kind of that's kind of hard.
What would be the
Um,
most like? What would you tell people if you're like you could change one thing today, stop this or add this or something like that? What would it be?
I would say move more. We are so sedentary and it's so hard because it's ingrained in us as a society. We're on our phones more, we're in front of a computer more. We're just not moving the way we were before. And if you look at the science, exercise helps with so many risk factors, right? Your blood pressure, your cholesterol, your blood sugar, and even your mental health, which on its own is a separate risk factor for cardiovascular disease, which a lot of people also don't talk about that as well. But it's involved with preventing so many things. If I had to absolutely pick one, it would be move more. And then on top of that, don't think of it as a chore. Make it part of your lifestyle, make it fun, and do it with people that you like and love. If you do it that way, you can actually stay consistent with it.
That's you're giving me very very good advice. I let life get very busy and I have not prioritized that lately. I used to be so good about it. I would put it on my calendar first and then work
Mhm.
around it.
Mhm.
And it's easy. It's a slippery slope when you kind of let it go for a little bit. So I'm going to hold myself accountable and take that challenge today and
See,
take
look
a
at that.
faster, take a walk, or get my son out and play and something like that. So, and I know that any movement works. Like there was the big movement with getting your 10,000 steps a day and stuff like that.
Mhm.
So I hope everyone's listening because they know that I'm a big believer in that kind of stuff. Okay, I have to ask you because I'm really trying to clean up my body and my health. But one thing I haven't ditched yet is the diet sodas.
Okay.
And I don't really want to give it up, so I just want and I know this is a big like I this is a lot of us have really a lot of stuff is being stripped from us, the sugar, the alcohol, all this stuff.
Mhm.
And how bad are diet sodas for us in our heart?
I mean, honestly, anything ultra processed, the body probably just doesn't like. That's the first thing. The
Okay.
second thing is we're all human. I mean, look, I drink one every once in a while as well too. So I think making sure if you're doing it in moderation, one, and you didn't make we got to talk after this.
We'll talk. Yeah, I make an appointment when I'm home for Thanksgiving. Yeah.
I mean, but also doing in moderation. Like for me, one thing that I know for sure, I can't completely strip certain things. So like, I love pizza. That's my like cheat meal go to. So
It's
once
fun
a
with
week,
kids and it's easy fun family night. Yeah.
Exactly. That's just going to be my go-to scheduled cheat day. I'm not going to feel bad about it because I know it's there on the calendar and I know for the rest of the week I'm going to behave myself. So if you're kind of intermittently and putting it in your routine that way, I wouldn't worry about it too much. Now,
Okay.
anything in excess is not going to be good. And of course, anything diet or ultra processed, I would just pay attention to the ingredients because as we're seeing now, everything causes something and it can be so
Yeah.
overwhelming.
I
So you
mean,
want to be careful for that.
it's really, really, really overwhelming to all the things that we're, and it's funny as a mom, I am really conscientious about what I give my son. And I need to be so much more conscientious about, what I put in my body. And I'm paying attention now to the forever chemicals that are in, what do they call
I can't even say, but I know exactly what you're talking about.
okay, yeah. That I that opened up a whole can of worms of like how much,
Same.
yeah. So
Same.
we're learning, it's a beautiful time to be alive because we're learning so much and there's so much education at our fingertips. It's
Mm.
also just really overwhelming. And
It's
so I like what
overwhelming.
you said, just in moderation, or pick a day or pick a time and know you're going to do it. So probably not 2 or 3 Diet Cokes a day.
Yeah, let's not do that.
Okay. I know.
Once every once in a while, we could just slap your wrist a little bit, but yeah, not that much.
I saw a heart surgeon talk recently about the top 5 things that he would advise someone to stop immediately. One was smoking, if you smoke. The second was Diet Coke
Yeah,
before alcohol. So it was smoking, Diet Coke, alcohol, and then flour, processed sugars and foods. And that really kind of woke me up. Just, I'm getting rid of a lot of the things on the list, but not all of them. So I'm slowly cleaning up my act. Anyone that follows me knows that I'm kind of especially when I'm working on set all day, I drink the Diet Coke. So I'm gonna substitute it for something else.
there you go. And also, just give yourself grace. Like you said, we're all trying to figure this thing out, and every week there's a new study about something that's conflicting a study about something else 2 weeks ago. So it's a lot to sort out. So just give yourself a little bit of grace as well, too.
Thank you. That's also very, very good advice because the stress doesn't help anything when you
At
stress less
all.
and put extra stress on our lives. Um, I I also just wanted to say how impressed I am with how you're encouraging so many young people to follow their dreams on your page, especially people in underserved communities and stuff like that, and how there's not that many women that are cardiologists. There's not that many people of color that are cardiologists. So I find it very inspiring. I really, really hope you guys go follow. It's Paging Dr. A. And is there anything else you want to leave us with today? I mean, hopefully we'll get many. Oh, you know what I should do before I do this? People sometimes ask questions. Let me just see if I've missed any major questions. Um, Sometimes it's hard to,
I know, you're trying to like look everywhere at the same
when you're
time.
trying to look, it gets a little, oh wait, I'm seeing some. Oh, a lot of people are responding to what you're saying. Um, I have to scroll way back. Sorry about this. Let's just see if
No,
there
no
are
worries.
any major questions. I think maybe okay, I'd have to go way back. I think maybe people are saying where they're from and they're in, yeah, okay. Oh yeah, okay. They were responding to, Standard Girl said she's been having the heart palpitations since menopause. So it is normal. Is that right?
Or I wouldn't say normal, it's common. It's very common, and it's part of the
Oh,
hormonal process shift. Yeah,
so just because it's common it doesn't mean it's normal. So it's something we
exactly.
get checked out.
Exactly. That's the biggest thing. We don't want to normalize it to the point where you're just because it could be something that we need to get a hold of, but sometimes it could be something benign. But until you see one of us, we can tell you that.
That's really very good advice. I know when I heard Oprah say that, it made me feel better because I knew I wasn't alone. So that's a first step. But it's not like, I'm glad you said that. Just because it's common does not mean it's normal. That's a common, that's a theme running through a lot of these lives and interviews I have with experts. They say it's common, but it's not normal.
You're
So
like, hold on now.
yeah.
Yeah,
Well, Dr. A, I am so grateful that you took the time. I know you're a very busy man. I look forward to seeing you when I'm in Houston, and
for
I would love
sure.
this again when we gather more questions. And everybody go follow him. And I want to thank again Patients Like Me for providing this platform for us.
Thank you
And
so much.
once
Yeah.
again, I want to remind you that there are clinical studies on patients like me, so please go check them out. And everyone have a very beautiful day.
Thank you so much. Thanks for having me.
Absolutely. Okay, I'll talk to you soon.
Bye.